Hi Arjun, this is Romina Boasso, and this is my presentation for work health and safety and risk management. So this is the communication, consultation and presentation and the new policy for academies Australasia. Organizational work health safety objectives and work health safety management system brief. So, the purpose of the Work Health and Safety Act is to ensure the health, safety, and welfare of all persons at work. This is obviously in Australia. The Act protects all persons, including visitors, customers, and contractors in an organization. Work health and safety is the shared responsibility of all management and staff within an organization. But to be effective, work health and safety requires the active participation of both staff and management. Both must be aware about the work health and safety policy inside of the organization. So we have as a relevant information reasons for a work health and safety management system. This is useful to improve the work health and safety measures adopted within the organization, to guarantee the monitoring of the work health safety rules at the workplace. And the purpose of a work health safety management system is to guarantee a healthy and safe work environment to employers and student members in academies Australasia. Then one question is, what are the functions of a work health and safety management system? That's the visible involvement and commitment from senior management, proof that health and safety policies and procedures have been implemented, clearly assigned responsibilities and monitoring of performance at the various management levels, specific program elements that include the identification and monitoring of hazard and emerging risk, including robust worker consultative arrangements as an essential element, reporting, investigation of incidents and ongoing workplace inspections. Another function is the collection and analysis of data in order to assist the prevention effort. Also, the availability of targeted health and safety training relevant to the undertaking. Another function is the consideration of health and safety aspects in the design of work and throughout the product or service life cycle, including through purchasing arrangements. Also, first aid arrangements and health monitoring appropriate to the health risks at the workplace, emergency management and response procedures in place, and also a continuing mechanism for work health and safety management system monitoring and evaluation. These are the functions of this system. Work health and safety policy requirements and commitment requirements to implement a work health and safety management system. The responsibilities for each member must be described on the work and health and safety policy. We also need to have an emergency procedure document. That's very important in every organization. We need a first aid procedure, an incident report form that the workers can fill when they have an accident or incident. We need to have periodically work health and safety committees to discuss about all the important matters in this team, and also record keeping of work health and safety documents. Information on this new work health and safety plan. We're going to implement the new policy. We need to create an incident report procedure. We need to create an incident report form. We need to create an emergency procedure. We need to create a first aid procedure. Also, we need to obtain a first aid box in the reception and kitchen area for all the people that is inside the campus. That could be trainers, staff, and also students. The work health and safety committees once per month they need to meet to discuss everything important on this matter. We need to create a record keeping of work health and safety documents, review the work health and safety policies and procedures once a year at least, and also put evacuation sign on the class and passageway so we can avoid incidents on campus. Information on the work health and safety plan implementation requirements. We also need to check the chemical labels once per week. Ergonometric instructions on the wall on how to carry heavy items so we avoid incidents. We need to put yellow signs when mopping the floors, give an ergonomic training, and include ergonometric tips on the wall to whom work long time seated, how to avoid bad postures or any kind of incident. How are you going to measure and evaluate this performance? These are the KPIs we're going to have in consideration. The amount of work health and safety inspections conducted, the number of workers who have complete work health and safety training, the number of design decisions made based on work health and safety outcomes, the amount of meetings where work health and safety was actively discussed, number of incident reports, the average time to take an action in case of any hazard identification. Review and improvement requirements of the work health and safety management system. For the continuous improvement of the plan and implementation for work health safety management system involves the review of, we need to review incident reports, job hazard assessment reports, inspection reports, investigation reports, safety policies and programs, safe work practices and procedures, training provided for safety purposes. To finalize my presentation, consulting outcomes. According to the consultation done on the 25th of July, the current work health and safety policy in Academies Australasia doesn't include the main points that are necessary to guarantee a safe and healthy work environment. The organization has some policies, but they are a little bit poor. So what we're going to do with this new system is to improve the responsibilities of each member need to be redescribed. So the responsibilities of every member of the organization have to be redescribed to improve the roles that they are going to play in improving this system. But in general, the other points were approved, so we will be able to put in practice this new system through the improvements that we have done during this consultation. Thanks, Arjun. This was my presentation. Good afternoon.